here.
All right.
Now let me
So
give
what
you
are
a let me give you a very simple analogy about epilepsy and the treatment, and that also needs to be understood very clearly by the common or everybody who is suffering from epilepsy. Because I already told you, because there are majority of the epilepsies are simple epilepsies and very few of them are complex epilepsies. Everybody understand that these epilepsies being self-limiting. Everybody understand that putting a anti-epileptic medicine treatment cures the epilepsy. Right.
But
That's how.
Yeah.
But now let me give you an analogy. Now suppose you have a fever. If you have a fever,
Yeah.
most of the time, this fever in our society here is because of the viral illnesses. Right?
Yeah.
And most of the fever, viral illnesses, they are self-limiting.
Yeah.
They go on their own. But whenever fever starts, you take a paracetamol,
Yeah.
tablet paracetamol.
Yeah.
And paracetamol is supposed to control the fever.
Yes.
So what paracetamol does is, actually, till the time you are going through a viral illness, your suffering is reduced by the paracetamol.
Yeah. It helps with
In
the effects,
controlling the fever or a symptom.
the symptoms.
It does not have any effect on the viral process itself, viral illness process. But everybody generally thinks that paracetamol cured their fever. Same analogy goes to the epilepsy.
All right.
So when the epilepsy appears, they are generally, majority of them are either self-limiting or they are benign, well-controlled. And that's why everybody thinks that anti-epileptic medicines cures the epilepsy. It is not. Anti-epileptic medicines are just trying to reduce your suffering or keeping you out of seizures. It prevents the seizures from happening till the time this epilepsy is active. Once it dies down, it dies down. You don't need a anti-epileptic medicine. The same analogy.
Now I understand.
Right? So, anti-epileptic medicine generally control the symptom. It has no control over the disease process. That's the most important understanding everybody should have.
Okay.
Because now, like suppose if your fever doesn't go after 3-4 days,
Yeah. Means that there is something
there
else.
has to be some cause to it.
Yeah.
Now, suppose let us say if you have a kidney infection,
Yeah. Paracetamol is not going to help the kidney.
you take kilos of paracetamol for years together, it's not going to help. Because unless you treat or find out the cause of the kidney infection or of your fever, treat it separately, then your fever will automatically go down. So if you keep on taking any anti-fever medicines, it's not going to help.
Yeah.
The same analogy goes to the epilepsy. What is the complex epilepsy? There is some cause to it.
Because in the brain.
In the brain, there is something or the other.
Yeah.
So even if you keep treating it with a lot of anti-epileptic drugs, which is a common practice,
It's not going to fade away.
it's just trying to control the seizures and make your sufferings low. It is not addressing the cause which is causing it. And that's the most fundamental thing that everybody should understand. And that is where the recognition of pattern, whether it's a simple epilepsy or a complex epilepsy, is important. Because if you don't understand this primary basic thing, then you are going to probably lose your years, wasting, putting a lot of anti-epileptic medicine, which is not supposed to work anyway. And they do not affect the basic disease process. They are just control the symptoms.
So what are the causes of drug-resistant epilepsy? You told me that there are like 4 types, correct?
Right.
So like structural, cryptogenic, genetic, and syndromic. Can you actually explain also the meaning of each of these terms?
Right. So generally, epilepsy is in a medical term or in a kind of simplified medical term. Brain is all an electrical continuum. Brain is an electrical functioning organ, right? So whenever there is what we call normally a short circuit in our vernacular term or language, short circuit means there is a hypersynchronous discharge, electrical discharge somewhere.
Hypersynchronous
electrical discharge somewhere.
All right.
You will have a trip. I mean, your electricity will trip.
Oh yeah. Okay. So
Right.
you kind of black out and you
Yeah.
cannot understand the
So
surroundings.
the same analogy goes with epilepsy again.
Mhm.
That it is the same. It trips when you go out of everything. It trips. It shut downs the brain.
All right.
So now, so whenever you have a structural malformation in the brain, it is not in sync with your normal neuronal arrangement. So it causes the short circuit, what we call
Okay.
erroneous discharges somewhere, electrical, and then it flushes into your normal neuronal system, and your normal neuronal system trips down,
Shuts down. All
shuts
right.
down. That's exactly what epilepsy is.
All right.
So you can have a structural causes. You can have a functional causes like what we typically call not structural means suppose you have infections. So infections are like suppose fire in this room.
Okay.
Infections are like a fire. So when it involves the brain, many times it cuts. Suppose you have a fire in this room.
Yeah.
You might have a insulation melted at some places in your underground wiring because of the fire. The similar process happens in the brain when you catch up with a meningitis or a meningoencephalitis or encephalitis-like illness or a brain infection.
Yeah. Yeah. Understood.
So the internal insulation of few wires that is melted, and you have again the trip.
Yeah. Yeah. Understand. Can you give an example of a structural cause as well?
Yeah, there is something called as focal cortical malformation, or there is a tumors, or there are the neuronal developmental tumors, or then there is some vascular malformation where it causes some changes in the blood circulation in the brain, and so that the neurons become hyperexcitable. So these are the structural malformations of the brain.
Okay.
And then there is a bigger classes of infections. So whenever infection happens, it leaves some sequel in the brain.
Use some.
Some residual affections in the brain in the form of some missed insulations from which the epilepsy will pop up.
Okay.
Right? And the third one is a genetic. Genetic means your brain is hyperexcitable because of some genetic malformation while your brain is being developed. And depending on the genetic structure, you can have a number of different malformations, a number of different epilepsy syndromes. And then there is something called as syndromic epilepsy. So syndromic epilepsy means syndrome by means that you have 4 or 5 common features in constellation of symptoms. I mean collection of symptoms, a bag of all the symptoms. For example, if you have a drug-resistant epilepsy with a cognitive decline, with a facial dysmorphism, with a nevus. So this is something you collect them and you call it a syndrome.
Okay.
By labeling the syndrome, you can generally understand that this is going to behave this way. You can predict the behavior of few syndromes. So these are the major causes of drug-resistant epilepsies around.
Okay. And regarding the syndromic, the cause is still somewhere in the brain.
Yeah, yes, of course. So whenever there is a drug-resistant epilepsy, there has to be some cause. So sometimes they are called cryptogenic. Now, cryptogenic means with the current level of development in the medical technology, we can still not find out those causes. And they are labeled as we don't know. Or a cryptogenic, we don't know. We couldn't find out. With the current level of resolution of medical imaging and understanding we have, we don't know what those are. So we label them negative, but your clinical history
is the evidence
of the disease, and we still can't find out. So these are called as cryptogenic causes of epilepsy.
Well, so the syndromic, based on the symptoms, can help us in identify where exactly the cause might be?
Not really the cause, but you can get a fair idea how clinically he is going to behave. Cause you have to find out separately by doing an investigation. We would come to that.
Okay, yeah.
So before going to the causes and so I wanted to give you a elaborate explanation or maybe a perspective of why drug resistant is important, or why drug resistant epilepsies are to be labeled and need to be investigated.
Okay, so
basically the gravity of the disease. Many people do not just understand the gravity of the disease. They just say, okay, fine, it's epilepsy. and we might have some one or seizures every maybe 1 month or so. So, but now imagine a kid, 3 year, 4 year, 5 year, who is suffering from epilepsy. Now, henceforth, probably we are not talking about a simple epilepsies because they are anyway controlled or cured.
Yes, sir.
What today I want to give a message is about, or what we are discussing today is about a complex epilepsies or drug resistant epilepsies, because that is the major burden which is prevalent in the society, not the simple epilepsies. So simple epilepsies are either cured or well controlled. We don't care about them.
Yeah.
They are normal people. They have normal intelligence, normal everything, normal productive lifespan. So that is not much of a concern. We are only talking about a drug resistant epilepsy.
Complex ones.
Complex ones. Now the complex epilepsies, now imagine a kid of 4 year, 5 year old. He started having seizures somewhere around 2 years, 3 years. Now continued to have multiple seizures every week. Now his doctors put him on like 2 drugs, 3 drugs, 4 drugs, depending on the severity of the disease. And he continues to have seizures. Now, if we do not timely investigate and try to treat it, this kid will primarily, this parent will easily relate what I am trying to tell now. They generally cannot have a normal childhood activities. They cannot play outside because one parent has to, I mean, the kid can have epilepsy anywhere. There is a total uncertainty involved.
Yeah.
So he cannot be left alone in the playground. Generally, these patients are on a lot of medicines. Generally, so that is the reason their grasping, focus, attention, it's all reduced.
Oh yeah, for the side effects. Of
Because medicines are trying to cool your brain. So generally they cannot focus in the school. So there over a period of time their scholastics go down. Third part is generally they are having a kind of, they do not have a self-confidence because they keep falling here, there. And then the peers or the friends,
There's a friends.
it's very difficult to have friends with this kind of disease you are having.
Yeah. So,
And then you are not allowed to go for any contact sports, swimming, cycling, because you can injure yourself, or you can have very serious complications because in a swimming pool if you can get it, right? And then over a period of time, what happens? You're technically not doing anything what a normal child is supposed to do. So your playing is out, your education is gone down, you have no friends. Generally, again, to take this kind of kids who can fall or who can have a convulsive episode to a social function is also a challenge for parents. Generally, it's very difficult for them to take because it's a kind of dramatic situation if you get a seizure episode in front of everybody.
Yeah, and also I saw it happening in like adults. Like there were some 30 years patients.
Yeah.
Right?
So this is like any age you can have it. So the idea is now this kid will lose those important early 5 to 10 years, which he is supposed to invest in education, live normal childhood activity. That's how you grow up into an adult.
Yeah. Obviously, for child it's even worse.
So you, and then one parent has to leave a job and always try to take. I mean, he has to take care of the kid because he can fall anywhere. He can have, and then all of this like makes more or less a life very complicated. Generally, I will say it is not a disease of a person. The whole family is affected. There are a lot of reviews and papers where the sibling life is also affected because of the kid who is having siblings. Sibling means
in
the
what ways are they affected?
So the parents, the whole focus is on the kid who is affected with epilepsy, and the brother or a sister or a sibling is generally not provided with doesn't get attention proper. Right? So,
Everything is focused.
Right. So all these things are like it adds to the gravity of the situation. It's not a simple. So over a period of time, when you lose all these years and grows into an adult, generally he is an isolated man or a woman from the societal fabrics, I would say. So if you keep treating this way, generally this kid who is just 5-year-old when he turns into a 15 or 20-year-old, he will be isolated from the societal fabrics. He just stays at home, does nothing, take anti-epileptic drugs, develop side effects. That's all.
And
No.
I guess you talk for experience, correct?
Sorry?
I don't know how to say it in English. Like you have experienced yourself this kind of situation happening
Yes, day in and day out.
in and day out. All right.
Because I almost interact almost like 5 to 10 drug resistant epilepsy patients every week.
Mhm.
I talk to them at length, what are their problems, and this is what this normally is. So now imagine the gravity of the situation. That is the reason we should not believe that they are simple epilepsies. That is the reason we should label them as a complex or drug resistant epilepsies and try to work around them.
Mhm.
That is the gravity of the situation.
Understand.
Yes. Now we can proceed to how to work around it.
Okay.
Yeah.
So actually, but first, before that, regarding like to keep saying the gravity of this situation, the situation can get worse by the amount of drugs that they put. So can you
Yes.
cite some side effects of the epilepsy drugs
Yeah. So
when they are alone or put in together?
So normally, whenever the child is put on a lot of drugs or 2 or 3 drugs, generally you keep on escalating the drug doses.
Mm-hmm.
First, you keep the drug doses escalation to a higher level, and then you introduce the next drug, and then you escalate the dose. Then you introduce the third drug, escalate the dose, and with all these 3 drugs, the major side effects are on the central nervous system or the brain, because these drugs primarily act on the brain. Now, what did they do? They try to reduce the excitability of the central nervous system, because epilepsy being a hyper-excitable disease,
Yeah.
the drugs try to slow down the brain by whatever means. And now it's a drug, so it cannot act selectively on the diseased area and leave apart the normal area, right?
So, yeah, it affects the whole.
It affects the whole brain. So fundamentally, it slows down your brain. So that results in loss of attention primarily. More or less, you are in a sedation effect or a brain slowdown effect. And then
Is there cognitive impairments?
yes, of course, but it is very difficult to prove. But yes,
To prove.
it is been there. So there is a cognitive decline, there is a loss of
Oh, yeah,
attention,
it's
there is a loss
difficult.
of focus.
Difficult to prove because the kid or the person has already gone into a cognitive impairment.
Yeah,
due
there
to
are
the
a lot of
epilepsy.
debates in this, whether these things cause or not, but let's not get there. But yes, definitely, all anti-epileptic drugs, they will have a loss of attention, loss of focus, loss of grasping, memory formation. And this, of course, this is complemented by the disease process itself. I mean, epilepsy is also a hyper-excitable disease, and these are so the whole combination is deadly.
Yeah.
So over a period of time, and then you have a behavioral changes, mood changes, lack of self-confidence, depression. These are the associated morbidities with epilepsy,
Okay.
and they go very hand in hand. So imagine you are a situation, you are in a 9th grade and you don't know what teacher is teaching you. You're still sitting in the class because parents want you to go to school. You are on 3 anti-epileptic drugs. You are more or less like zong. And then your friend asks you a question, and then you don't know the answer. So what kind of situation you would be in? And this happens every day, right? So that's enough to break anyone's confidence. So when they grow, they are more or less like a learning disability, depression, and all those things, right? And this is an immediate complication. First, I mean, whenever you start them. So the later complications like anti-epileptic drugs can have on the blood, on the bone. You have a brittle bones, easily breakable bones. And then over a period of time, if you take it for 25, 30 long years, you can have other complications, systemic complications. Yeah, because fundamentally, when you're trying to treat a fever, with a
only
paracetamol,
Yeah.
so you have to treat it for life, right?
Yeah.
Because you're not treating the cause. So whenever you are trying to treat a drug-resistant epilepsy with the drugs, it means you're trying to control it. You have to treat it for life.
For life, yes.
Yeah.
Right. And
So
this is obviously for the complex ones.
Yeah,
So
of course, for the complex again.
30% of the
Only
epilepsy.
we are talking only about the drug-resistant epilepsies here. So yeah, so that's why I mean that's how the anti-epileptic drugs causes lot of complications around.